It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following: excessive thirst in dogs, causes and when to worry. Did you notice that your dog suddenly drinks a lot of water? Excessive thirst in dogs, also known as polydipsia, should not be ignored. There are many possible causes of excessive thirst in dogs, and some of them can be life-threatening if not treated early. If your dog is suddenly very thirsty for a day or so, it's usually not a cause for concern. Dogs may drink more if they are very hot, bored, have eaten certain foods, or have recently exercised. Very active dogs and lactating dogs drink more than other dogs. However, if your dog has started constantly draining the water bowl and eliminating it, and this has been going on for more than a few days, then it's time to get it checked out by your vet. Your vet may check him out for the following most common medical reasons for excessive thirst. Let's see. 1. Diabetes mellitus. Diabetes mellitus causes high blood sugar that is due to insulin deficiency or insulin resistance. Excess blood sugar is excreted by the kidneys in the urine and carries water with it. In this case, excessive urination can lead to excessive thirst in dogs. Diabetes mellitus is treated by modifying the dog's meals and administering insulin. 2. Kidney disease. Dogs with kidney problems may not be able to concentrate their urine. They urinate more, and to avoid dehydration, they have to drink more. Kidney disease is treated by modifying the dog's food and addressing the underlying causes of kidney failure, such as kidney infections or stones. 3. Cushing's syndrome. Cushing's syndrome occurs when the adrenal gland excretes excessive amounts of cortisol, either due to a tumor on the pituitary gland or an adrenal tumor. Excess cortisol increases thirst, which in turn increases urination. Depending on the location of the tumor, Cushing's syndrome is treated with medication or surgery. 4. Diarrhea or vomiting. Any dog that has diarrhea or vomiting is losing body fluids. To avoid dehydration, dogs that have recently had diarrhea and/or vomiting may drink more than normal. 5. Pyometra. Pyometra is the medical term for an infected uterus. This condition only occurs in female dogs that have not been spayed. Pyometra is a life-threatening condition and requires immediate surgical treatment, antibiotics, and rehydration with intravenous fluid therapy. Other causes of excessive thirst in dogs. Some other reasons why your dog may be excessively thirsty are as follows: dehydration, liver disease, cancer, infection, fever, medications, including steroids and diuretics, heat stroke or hyperthermia, diabetes insipidus, hyperthyroidism, parasites, hypercalcemia. In each of these cases, treatment varies depending on the underlying cause. When should you make an appointment with your vet? If you notice that your dog is drinking much more water than usual, make an appointment with your vet as soon as possible. It can be helpful if you bring a urine sample and you need to answer your vet's questions, such as what type of food you have been feeding your dog, if there have been any changes in your dog's appetite or habits, any travel history, and a record of your dog's vaccination and preventative care history. Your vet will perform a complete physical exam on your dog and will likely recommend various laboratory tests. Make sure you follow all the recommendations. The most common laboratory tests ordered include a complete blood count, blood serum chemistry, urine-specific gravity, and urinalysis. These tests are important to narrow down possible causes. It will give your vet information about how your dog's liver and kidneys are working, whether there are signs of infections such as elevated white blood cells, and can help rule out conditions such as diabetes mellitus and Cushing's syndrome. Urine-specific gravity tests how concentrated your dog's urine is and can help diagnose kidney disease and dehydration. A urinalysis can determine if there is sugar or bacteria in the urine, among other things. If your dog is suddenly drinking a lot of water and urinating more frequently, don't take the water away. Doing so can put your dog at risk of life-threatening dehydration. Signs of dehydration include seeking water, excessive tiredness, dry or sticky gums, loss of skin elasticity, and mucus saliva. With the help of your vet, you will be able to determine if your dog's drinking habit is indicative of a larger problem or if it is harmless. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend, a hunt, and until the next video,